Hey, welcome everyone. Thank you for coming. I'm going to be talking a little bit about a book that Dr. Hedlund Claire Hoffman and I wrote on existential humanistic case formulation. She's still on her way here, but will be here shortly. Um, but this book is on case formulation and existential humanistic therapy, and I'll pass it around here. Existential humanistic therapy is a branch of therapy that was developed in the United States. There's a number of different schools of existential therapy, and this is one of them, and it's sometimes called the American school. It was heavily influenced early on by Rolla May and James Bugenthal, and over time, there have been a number of other contributors, and it's evolved a little bit over time. It blends some of the European existential ideas with humanistic psychology that was also originated in the United States. And Lynn and I had been considering this book for some time. In part, our motivation for this was we had a lot of graduate students come to us that were interested in doing either practicums really focusing on existential humanistic, or they were going to want to do their comprehensive examinations focusing on existential humanistic therapy, and there were no models out there. And so when they tried to use this model for comprehensive examinations, which often asked for students to do a case formulation, they really struggled and sometimes didn't pass their exams because of that. And they were sometimes discouraged from being able to use this approach in practicum sites and internships. So we decided that it was important to develop a model for students in particular, but also it's important for therapists. Existential humanistic therapy, there's a lot of research that supports it, but there's not been many outcome studies. And part of the reason there have not been outcome studies is because there hasn't been a more formalized approach to case formulation, something that you could draw from to be able to do the research on. So this also provides a basis for being able to conduct a lot more research on existential humanistic therapy, which is one of the things that we're really excited about with this. So the process that we went about in developing this is we started a number of years ago. We did some research and we asked a couple of things of people who identified as existential humanistic therapists. We asked them, for one, what are the primary things that you look at when you're doing case formulations or case conceptualizations? What are the things that really stand out to you as important? And we also asked, who were the most important theorists that influenced the development of your theoretical understanding and your clinical practice? And we used that to identify an initial set of key themes. And from those key themes, we revised them a little bit over time from teaching it in various places in China and the United States. And through that process, then we came up with our approach to existential humanistic case formulation. And the challenge in this is that a lot of times people that are drawn towards existential humanistic therapy, they're very kind of against case formulation, and for some good reasons. They have principled reasons for this. That when you start to do the case formulation, a lot of times you're forcing people into a box a little bit. It's overly structured, and also, as Dave Elkins talked about a lot, once we get kind of that idea of the client, it's very easy to not recognize the emergent issues. And this is something that for those of you who've done supervision, you've maybe seen as we put a diagnosis on, or we put other labels on, and then we start seeing everything through that lens, and we don't always recognize how it may change or evolve or new issues that come up. So trying to find something that had the balance of having enough structure to really inform some of the things that we're doing in therapy and track some of the things we're doing in therapy, but not so much structure to limit it and make it more difficult for us to see clients, was really one of the challenges that we had. We also wanted to make sure that there was a balance. A lot of times what case formulation focuses on is just the problems. And if we understand someone just in the context of the problems without also understanding the strengths, this distorts the picture a little bit. Now, often what you'll see is in a lot of case formulation approaches, there'll be a place to talk about strengths. And that's nice, but we didn't feel like that was quite adequate. So we start off in our approach to this, in the very first section, is doing a holistic client narrative. Now, when teaching this approach, This is the section that a lot of times people struggle with the most because they're so drawn towards focusing on the problems. But the idea with this was to have a broad narrative that to understand the client and who they are apart from the problem. And so it really is emphasizing a little bit of a different approach there. When you start to do this apart from the problem, it develops all kinds of resources though too. When you look at things such as coping mechanisms or developing resources like that, which is not a primary focus in existential humanistic therapy, but it's necessary and important at times. What we often do is we take things that are external to the client and we suggest take these things that are kind of foreign to the client, that are different, and try these out. What getting the holistic narrative does is this allows us to much better look at what are the client's natural strengths and resources and how might we be able to use those incorporated into coping. So there's been some humanistic and existential humanistic therapists that argue before we go to things like DBT skills and other skills, not that these are bad, but before we go to them, maybe first we should look at what are ways that we can help clients to deal with some of these stressors in ways that draws upon their natural resources, their natural interest. How do we develop these in ways that may fit a little bit better or into relational approaches or strategies? So this opening narrative, it really provides an important framework for doing that. But also when you start off by looking at a client more holistically, it changes how you see the client. And that's something that from doing supervision for many years, it really stands out to me that when you start with this big holistic narrative, instead of start by just focusing in on the problems, you see the client in a different light. And that's an important thing. So as we go throughout the different sections, we always try and start with kind of these broader perspectives to help frame it. So we do have a section then on problem identification, but we wanted to do this again in a way that it's a little different than what a lot of mainstream approaches might do that. So we looked not only at the individual, but we really focused a lot on contextual issues. And this helps to build more of a liberatory type model.
Yes.
One of the things that we argued early in the book is that a lot of case formulation in a lot of ways is inherently kind of colonizing in a sense. It's inherently putting something on. It's using an external framework that's largely been developed by Western perspectives upon a client, and it looks at it in a very individualistic lens. So by stepping back from that and trying to understand the client's view of the problem as primary, but also looking at what are the systemic issues that are contributing to the problems and putting those as primary. Sometimes the problem is as much or more about the system than it is the individual. But most of our systems and most of our approaches to case formulation and what insurance companies and other places often want to see is something different. They want to see it focused on the individual because that makes it more manageable in certain ways, even if it might distort the process. So by looking at this broader framework, we thought that was really important in getting a broader perspective on this. After we get to the problem identification, then we move to that theoretical understanding. And that theoretical understanding, there's a mix here. There's a lot of things that are kind of compromised here. We see this in the problem formulation too. Because when you look at things like evidence-based practice, they will say that we need to use some framework to identify a problem. That doesn't necessarily have to always be the DSM. There can be other ways of identifying and describing the problem. And so this allows for people, if you're in a setting where the DSM is required, you can use the DSM. Or you might be able to use an alternative like the ICD or the psychoanalytic diagnostic manual, other frameworks. So the power, threat, and meaning is a really nice one that fits with a existential humanistic approach. Or in some settings, you may be able to just do case formulation. Lucy Johnstone talked about the case formulation as an actual alternative to diagnosis in a lot of settings that doesn't emphasize the pathologizing of the individual nearly as much. So we're trying to do a bit of this hybrid so that when you're in settings where some of these things are going to be required, this approach will still work, but we're adding on an emphasis and we're framing it in this EH light. And so when we go through the EH perspective early on, you'll see things that are, a lot of case formulations, such as looking at biological considerations, family considerations, and all these considerations. but we add on some others, including different ways of looking at cultural considerations, looking at the existential givens and how they impact, looking at aspects of the relationship. So it really provides a nice hybrid, a nice blend there between the different ways of looking at that. And then we can focus on, in large part, what the client is wanting to do there. When you get to the final, on the treatment section, then we start off again with a client narrative of how they would like their life to be. This is a little bit different. We talk about goals all the time, but what we're encouraging is starting by talking about a narrative. How would you like to be? Kirk Schneider talks about the idea of how are you willing to live? This is similar to that, and that can be integrated in with this, but how would you like your life to be? And having people describe that. And after you get that broader vision of how you would like life to be, then stepping back, and from there looking at what are the client goals, which are separate from the treatment goals. So you have both the client goals and the treatment goals. So when you're working with, third-party payers and insurance companies, you can have the treatment goals that they're going to require and they want you to spend time on, but also the client goals. Sometimes those might have great overlap or be the same. Other times they might be very different. But by focusing on what the client wants, a lot of times you're going to get better buy-in to some of the treatment goals too, because we're focusing on what the client wants. And it fits with that existential mentality as well, because what Viktor Frankl talked about, for example, is that happiness becomes more elusive when you pursue it directly. It is better a byproduct of a well-lived life. So that narrative and the client goals, those focus on how do we build a well-lived life? And those may very naturally address some of those treatment goals then, which is what the insurance companies are going to want. So again, we're staying very centered in with integrity within this EH approach, but we're trying to design it in a way that it can be used where we can convince insurance companies and third-party payers that we're also meeting the needs that they are looking for and what they're willing to pay for. Then we move to the interventions, so the treatment plan there. And those, again, we focus a lot on existential humanistic interventions. That's put in there first. But then we talk about integrative interventions. And integrative, there's some that are more naturally fitting with an existential humanistic approach, but there may be other times where we need to integrate something that is a little more disparate from how we typically work in an EH framework, such as cognitive behavioral or dialectical behavioral. There may be times we could still integrate that, but we start with those existential humanistic. And one of the things that we did then with this, because there is the perception that existential humanistic therapy does not fit with evidence-based practice. And if you've practiced from this approach, you know that's not true, most likely, but that's the wide perception out there, is that it doesn't fit with evidence-based practice. So what we've done is created a place where you can line up. Here's the kind of theoretical understanding. Here's how it translates, from the problem identification to the theoretical understanding to the treatment goals. And then there's a companion value to this book, which we'll be talking about on Friday at 9:30 here on the evidence-based foundations of existential humanistic therapy. And what that book does is it takes a process approach to looking at evidence-based practice, which means we look at the components of therapy. And I would argue that looking at the components of therapy instead of the general outcome studies is a much better way of doing it. There's a lot of critiques of the outcome studies, and that can take a lot of time to go into, but we talk a little bit about that in that book. But what you can do then is you can line up both the existential humanistic techniques and some integrative techniques that align more closely with the existential approach. You can line those up with the treatment plan to be able to demonstrate through the case formulation that you are practicing consistent with evidence-based practice.
Right.
So this takes it a little bit step further than just being that theoretical formulation. It also becomes a bit of a political book in this sense, because it is speaking back to these misperceptions of existential humanistic therapy. And also, I think some of the limitations in some mainstream approaches by looking at a broader way of conceptualizing struggles in health that goes beyond just this pathologizing approach. But we can demonstrate very clearly that it is supported by the research evidence there. So that is kind of our book in a nutshell. And my co-author has arrived, Dr. Claire Hoffman here too. Um, but we're hoping that maybe this will be of some interest to you, practical value to you, and looking at how you can use this not just to do the formulations that sometimes we have to do, but it can be a tool. So if you're a student, you're in a practicum site, and they're telling you can't do this type of therapy, you can take this book and the evidence-based practice book and say, why not? We've got the evidence here that shows that this is a bona fide approach with strong research foundations. So you can advocate for this. If you have an insurance company and you develop a treatment plan and they say you can't use this approach because where is the evidence basis for it? You could again come back and show here's the evidence basis for it. The other thing that hopefully this will do as well, let's see where I'm at on time, we're at the end. The other thing that hopefully it'll do is this approach sometimes is intimidating to students and people just learning it, including professionals that are kind of gravitating towards it because it's talked about as a techniqueless approach. And so as a techniqueless approach, how do you do this? Well, what we hope this will do is it'll provide enough structure so that in those early phases of learning this approach, you have some structures to guide. And it may be some of this you let go over time because it just becomes natural. That's the ideal. Whitaker talked about this idea that, with books, that you read this book and forget it. And Rollo May talked about read everything you can about psychotherapy and psychology and then leave it at the door when you go see your client so you can be with them in this relational way. Well, this can provide a guide that helps you start to do that. And then over time, you might pull back some of that artificial aspects of the structure to be able to be there in the relationship. But you're able to be there in the relationship in a way where you've developed this understanding where it's very well rooted in who you are. So it comes out more naturally and organically than it might be early on when you're first learning this approach. So that's our book. Right. And if you have any questions, I think we're at the end of time here, but I'd be happy to answer any questions off to the side. Thank you very much.